So the parents come to us extremely worried and had, heard about hyperbarics at some place or another and said, hey, we want to try this and see how it goes. And, she remembers things that she didn't remember before. And it was really moving. We're talking about a preteen girl who was losing her memory due to an injury. And being able to reduce that inflammation and bring those memories back was really powerful for us. It was an emotional thing to see the smile from the family and her because her memories were coming back.
Welcome to In Good Company.
Welcome to the In Good Company podcast, where we have real conversations with people who are helping others age better, live better, and stay healthy. Today, we got a really unique and powerful conversation lineup. We're joined by Jason Holdman, owner of the Hyperbaric Chambers of the Ozarks, who turned a deeply personal health journey into a mission to help others heal. And alongside him is Dr. John Lilly, a doctor of osteopathic medicine with over 2 decades of experience in patient care, now serving as medical director and continuing his work in primary care here in Springfield. Together, they bring both the real-life results and the medical perspective behind hyperbaric oxygen therapy. Gentlemen, welcome to our podcast.
Thank you. Thank you for having us.
Yeah, Jason, Dr. Lilly, thank you for being here.
I'm excited.
Let's kick it off. The general public may have heard of hyperbaric. They may have heard of it as it relates to helping somebody who may have been in a diving accident, perhaps,
right,
or that sort of thing. But there may not be familiar how it's utilized as treatment today. Can you help describe what it is and how it's used?
I can, yeah. Doc, if you want me, I'll take this one just to start. The baseline physiology behind hyperbarics, it's very, very simple science. It's oxygen and pressure. And I'll get into the story of how I came into how it came into my interest in just a second. But what essentially it does is it decreases inflammation, it reverses the low oxygen state, releases stem cells, and it's also an anti-infective. So to, I guess, back up and explain how I ended up being the owner of Hyperbaric Chambers of the Ozarks, my wife we were on vacation years ago, and she came off a boat in very shallow water, and the ripples on the bottom of the ocean from the sand. She'd broken her 5th metatarsal, and the injury should have gone surgical. Doctor had recommended that it heal on its own, and it did. And then a year and a half or so later, she's doing yoga, of all things, and breaks that bone again, but really did some damage. So she spent a lot of time in a boot. She spent a lot of time with her gait being out of whack, and developed some lower back pain. And obviously we went the medical route, trying to figure out what was causing that. Ended up going to St. Louis to get, and Dr. Lilly may know what this procedure is called, but get a nerve burning procedure where you must be awake. There's no anesthesia, anything like that. It's notoriously brutal. So she went in and got the nerve burning procedure, and then a year later the nerves grew back and the pain was back. So we went and did it again, and she came to me during that period of a couple of years where she was really suffering and has having a limp from all this. Came to me a couple of times with this homeopathic therapy or this supplement or this thing. So I had started to become skeptical about what she anything she brought to me. While I was willing to do anything to help her feel better, she says, I think I want to try a hyperbaric chamber. And having our hopes dashed a few times prior to trying this new thing that she brought to me, I said, okay, let me do a little research. We'll take a look at it. And it became evident very quickly with my limited medical experience that this is just simple science. This is oxygen and pressure. When we're out here just breathing the oxygen that we breathe every day, we're 21% oxygen at sea level. There's only so much oxygen carrying capacity in the body. Your red blood cells load up with oxygen. That's why if you put a pulse ox on, it's going to read 95, 96%. As you breathe, the trucks are kind of loaded. And what putting oxygen under pressure does to really simulate, being under seawater, it helps liquefy the oxygen. It's a law called Henry's law. The physics behind this is that When you put oxygen under pressure, breathe oxygen, pure oxygen through a mask, the more gas you put under the pressure, the more that gas turns to liquid. Well, as that oxygen liquefies, it goes into the plasma of the blood and deeper into the tissues. This is a medical device. This is medicine, and oxygen is a very powerful medicine. And when you put that oxygen under pressure and give it to it drives into the plasma, which drives into the tissues. It's a whole other ballgame. Your body gets supercharged to heal from the energy that oxygen's providing, and there's only one way to do that, and that's to get it under pressure.
So if somebody's going on the internet and like researching hyperbaric treatment, and there's all kinds of influencers out there who might purport a lot of different things. Are there any claims that you feel like maybe are crossing a line there?
To me, it's you don't want to make this a cure-all. It's not the sort of thing where, hey, you get in a hyperbaric chamber and everything is we can fix everything. But reversing low oxidative states, dropping inflammation. I mean, most disease pathways, if not all, are rooted in inflammation. Oxygen lowers inflammation. It's really simple stuff. I'm sure many of your guests are going to be able to throw bigger words, around than me. You get your blood oxygen up, your inflammation goes down, you feel better, things start healing. That's the simple version of it.
Yeah.
So do I think there are any claims that are going over the line? Based on what we've seen, I don't know that hyperbarics will help everybody right now, but I know at some point in our lives, specifically as we age, and the vascular system starts. Think about it, as you get older, your brain shrinks. Well, it's because your vascular system up there is not functioning like it used to. Well, feed some oxygen into that, and it literally helps in the formation of new blood vessels and helping the body to do what it's originally designed to do by our Creator.
So kind of leaning into the vascularity of the brain, or you feel like it has an effect on, like, say, dementia?
I do, because I've seen it. Young girl with a TBI had lost some of her childhood memories, just gone. So the parents come to us extremely worried and had heard about hyperbarics at some place or another and said, hey, we want to try this and see how it goes. And she remembers things that she didn't remember before. And it was really moving. We're talking about a preteen girl who was losing her memory due to an injury. And being able to reduce that inflammation and bring those memories back was really powerful for us. I'm sorry I'm getting emotional, but it was an emotional thing to see. The smile from the family and her, because her memories were coming back. So, hey, do I think some people are stepping over the line with that stuff? I can only report to what I've seen, and felt personally with my brain fog. It helps.
That's great.
That's great from everything I've seen.
So Dr. Lilly, let's talk about the science.
Okay. And hyperbarics, it's not like selling a pill. There's nobody out there that is going to make billions of dollars getting a bunch of research done on hyperbaric chambers. A lot of the research now, I found out, is coming from Israel. And there are a couple of universities over there that one of them has a whole department on hyperbarics. And they are doing most of the research outside the United States. And there's not a lot of research because nobody can, nobody's making a lot of money off of it. So they're not going to do a lot of research. But that being said, there's a lot of anecdotal evidence out there. And yeah, even though the plural of anecdote is anecdotes, not data, we have seen at Hyperbaric Chambers of the Ozarks, a lot of people come in and have significant improvement. People coming in with walkers can barely walk, and a few weeks later, they're not using their walker. It's astounding some of the improvement that people get from the hyperbaric treatment. And poor Lori said, I wish I would have documented some of these cases earlier, got a video of what they were before and after. So it really is, an amazing treatment. And there's still some, that there's now 14 diagnoses that are approved by the FDA.
So can we go over what diagnoses are currently approved and what diagnoses you think should be approved?
Yes.
Yeah, sure.
The ones that are approved by hyperbaric oxygen therapy, air or gas embolism, you get little bubbles. That's what divers get. Decompression sickness, what divers get. Carbon monoxide poisoning, diabetic foot ulcers, and some other non-healing ulcers, severe burns, sudden sensorineural hearing loss. If you have a complete hearing loss, hyperbarics can help it. Radiation tissue damage, severe anemia, crush injuries, non-healing wounds, skin grafts and flaps, necrotizing soft tissue infections, and avascular necrosis, which is bones can get that. Like a lot of times you'll get it in the hip bone, the ball of the ball and socket. The bone marrow starts to die, and you get to the point where you got to do a hip replacement. So those are the 14 that have been approved by the Food and Drug Administration. Current research over in Israel, they're looking at post-concussion syndrome due to traumatic brain injuries.
That I've seen more than once
Yeah.
have a tremendous impact.
Age-related cognitive function decline, post-stroke recovery, fibromyalgia and chronic pain syndrome, and post-traumatic stress disorder.
Oh, wow.
They've also done research on long COVID, the COVID symptoms that are lasting for months and years. Some autoimmune disorders as an adjunct to breast cancer. They're finding that it can help because you're getting more oxygen to the tissue. So those are some of them that, they're not real common, but they're fairly common. And the establishment medicine can do some, but a lot of times it is for strokes and traumatic brain injury. It's just, they say, you got to wait and see how well it heals. Mm-hmm. Well, hyperbaric oxygen therapy is helping it heal better by getting more oxygen. Again, if you're under breathing pure oxygen and you're under 2 atmospheres of pressure, the amount of oxygen that's getting to the tissue is 10 times the amount of normal atmospheric pressure and us just breathing room air.
Wow.
So it really is a way to get the body to help heal itself. New blood, it helps new blood vessels grow. So there's some amazing things that just getting more oxygen to the cells helps.
I'm assuming there's a difference. You have folks that are being sent over by physicians with the FDA-approved diagnosis, and that's being handled by insurance.
No, we're off-label.
Off-label.
Yeah, we're
okay.
off-label. Yeah. And the off-label indications here are because it's so limited. It's so limited. And even then, we've had clients who are patients who should have been covered, and couldn't be. Give you an example. This is just a couple of months ago. We had a client who had an open leg wound for 18 months. We closed that wound in 13 sessions and healed it in 18. Wow. So inside of 2.5 weeks, we closed that wound. No pills, no shots, no medicine other than oxygen, and completely closed that wound, and it was completely healed in 18 sessions.
What's the cost?
We do, and we offer everything from single sessions to packages. In the interest of competition, I won't lay that out. I can tell you our single sessions are $145. The price decreases as you do more packages, and it's important to us that we are results based. I can tell you this: the cost is very low for the benefit, but it like I say, they cost less per session as we do more packages.
Yeah, and part of that is insurance. They're in the business to make money, and they will go by, well, is it FDA approved? Well, there's a lot of things that we've been treated that aren't FDA approved, and the insurance company is going to say, well, we're not going to cover it because it's not FDA approved. Even if you have a very good case for something, they'll still say, no, that's not our policy. I had a young woman that was very depressed. I got her started on some medicine. She was making progress, but I was having to go above the FDA limit. And the insurance companies will have this so-called peer-to-peer review. And they have their doctors, and we call in and explain the situation, hopefully get them to cover something that we're wanting to do. And so I called in, and I even had scores for the PHQ-9 that we use to score how bad your depression is. She was getting better and better, but she hit the FDA limit, and I wanted to go above it. So I did this peer-to-peer review, and the doctor listened to the whole thing. I said, can we go higher? And he said, no, that's not our policy. Really? She's making progress. That's not our policy. Nope, can't have it. So I thought, well, what good is a peer-to-peer review if their answer every time is going to be, that's not our policy. We're not going to make any changes to our policy. Because if they do it for one, then they got to do it for everybody. So it really is, and again, there's not a lot of research that the FDA would say, yeah, this is enough for us to approve it for this diagnosis. The 14 that they've got, those are extreme diagnoses. So getting things like post-traumatic stress disorder, strokes, stuff, it's hard to get FDA approval for that. So a lot of times the physicians that go through insurance and people are going through their insurance, they can only do what the insurance is going to approve. And yeah, sometimes, 6 months or a year goes by and then they do the Hail Mary, say, I'm not any better. Let's try this, because I haven't got any more options. And it works. And you think, well, why couldn't you have come there a year before? Because the insurance wouldn't have paid for it.
Yeah, let's face it. People want their doctor to say, hey, this is it's why we go to the doctor. They want to say, hey, here's what you want to do. It's just they're so limited in the scope, specifically with hyperbarics, where, to me, it seemed like this doctor cared for this patient enough to the Lyme patient specifically to throw everything he had at this thing and then say, hey, let's go try this hyperbaric chamber. And it is just so simple to me that the off-label indications here, I mean, I can heal your radiation, basically damage from chemo, I'm guessing is what that is. I can heal that.
Well, from radiation, because there's a lot of treatment for cancer that is radiation.
Yeah. Yeah, so it's a
targeting
wound,
that.
correct?
But,
I can
yeah.
hear that. I can heal that, but I can't close this lady's leg up at the hospital. So I think we really fill a good space with because hey, we've just moved here to Ozark. We're very excited. Came out of Springfield. We were inside of a medical spa in Springfield, and we just quickly discovered while there are tremendous. Hey, we've got CrossFitters. I've got a strongman. The guy is a mountain of a man. One of those that actually this guy barely fits in the chamber. We've got to turn him sideways and roll a gurney in. Before he goes and competes internationally, he gets his blood oxygen up. This guy knows what he's doing, though. He's in tune with his body and doing the big strongman competitions with the giant tires and stuff. And we've got CrossFitters and I've got MMA fighters and stuff like that. But we barely quickly realized, hey, the people that need us and the people we enjoy the most, frankly, are those that are coming in that experience that period of relaxation, that time with Lori and Keegan, our other tech, where they just get to come and break up the day, and get their treatment and feel better. The sick we've decided, hey, we want to see more sick people. We want to help with that, the college student that got the concussion, or the guy that was in the motorcycle accident, or that early onset dementia, or maybe sometimes later onset dementia that we wish we'd have gotten to earlier. We're really starting enjoying seeing those benefits and seeing the people come in and out of our office. It's just very fulfilling to watch. These are people in very, very hard times in their lives. And then we've unfortunately gotten to some clients who are on that Hail Mary and the ball's just being thrown too late. And that's a painful part of it too, is like, okay, why, what would happen if we had gotten here 3 years ago? In conjunction with all of the traditional stuff. I'm not saying, hey, I'm not holistic. I'm not any sort of, I'm not medical. I'm not holistic. I own this clinic and I've tasked good people to man it and take care of my clients. I clearly believe in the therapy because of what I've felt and seen with my own eyes and in my own home. But man, what if we could just get them in a little earlier? I think that's the hard part for us every day is to go, man, if we just met this person a year ago, and that's why with the protocol and making sure we're focusing on the results and consulting Dr. Lilly and saying, hey, here's what we've got. What do you think we need to do? And then following the customer, meeting them where they are, is, hey, let's start with 10 sessions. Let's start with 10 sessions here and see how we feel.
Dr. Lee, could you walk us through how you determine the amount of sessions that are needed per client?
Part of that is you see how they progress. It's the client's progression through it. Again, it's common, you do a lot of, 10 sessions.
10 sessions is a good indicator where we start there. And what we sell very little of is a single session. We tell our customers, a lot of people, hey, I'd like to try this. Here's $145. Let's give it a go. And we're like, hey, that's not how this works. We want you to get results. 10 sessions is a good baseline where we can consult with Dr. Lilly and have talk to the client and say, hey, here's how I'm feeling. Many times getting them to continue is not a problem. Right? They're feeling better, they're sleeping better, their mood's better. Like I say, there's so much going on, and inside the body, and when you reduce that low oxygen state and start dropping inflammation. So getting them continues is really not a problem. We just want to make sure that we pace it and don't take them beyond where they they need to be, because it is a 90-minute session.
Are they always 90 minutes?
Yeah. Some places will offer an hour, and we probably should get into the difference between chambers, soft chambers, hard chambers, stuff like that. Equipment's going to be important. But some places will offer an hour. We schedule ourselves at 90 minutes because it's maximum benefit. It's going to take 15 minutes to bring you down to pressure. And we have different pressure settings. It's one thing that we always discuss is, hey, I don't start anybody off at 2 atmospheres. It's just, we want to see how their body reacts to this stuff. We can start at 1.3, go to 1.5, go from there. But yeah, it's 15 minutes up, 15 minutes down, you're getting a good solid hour of of that oxygen load, and allowing for the up and down time. It's just what we want to do. We don't want to sell hour sessions so somebody can save $20. We want this to work. And our equipment is set up that way as well. These are medical grade chambers. There's different chambers out there, but it's our belief that the hard chambers are I think soft chambers. Do you guys know the difference at all?
Walk us through that.
Well, there's a market out there for the home chamber where you can get a soft chamber. It's it'll sound a little so kind of like air in a bag. All right. So the way the equipment works, and I think it's important too to differentiate between what's going on in a hospital chamber versus ours from a safety perspective. Hospital chambers can go Doc, I want to say all the way to 3 atmospheres, which is that's getting after it. You're
Wow.
deep. You're under pressure. It's a life-saving device. Someone comes in with carbon monoxide poisoning. It's pretty important we get that oxygen right quickly. Where ours will go higher, we choose to max out at 2. There's really no benefit over 2 atmospheres that we're going to see. But in that setting, they are pumping O2 into the pressurized chamber, pressurized oxygen into the pressurized chamber. The patient is breathing 100% oxygen. Okay. We run ambient air into our chambers and feed the oxygen into the chamber via a mask or a cannula, whatever the customer's more comfortable with. And the gas exchange is happening inside the lungs. It's not going to do us any real benefit or give the client any more benefit to feed them pure O2 and pressurize a chamber with O2. You've got to dress them down. You've got to, if you get in a hospital chamber, you've got to wear a paper gown and all of that because you're filling a chamber with O2. If you don't treat that right, the thing's a bomb, right?
Yeah.
Whereas inside our chamber, the ambient air inside our chamber is running at, 22, 23%. There's nothing flammable about that. So if they want to take in a book and flip through the pages of the book, we don't have to worry about the pages of the book, sparking. So it's much safer. But whereas when you go down to the soft chambers that are out there, you've got different med spas and people will buy one for the home. While they're not inexpensive, your max is 1.3 atmospheres, and finding that equipment that's going to accurately pressurize to 1.3 atmospheres, feeding oxygen through a concentrator. Put it this way, you're going to do a lot of sessions inside of a soft chamber to get what a hard chamber will do at 2 atmospheres. So the equipment is not only safe, it's comfortable. There are chambers out there that lay on the floor and they have a little kind of a door on them. And it's almost like you have to crawl down into the chamber. Well, I've got a lot of clients. There's no way they're getting in one of those chambers. So ours are specifically built with a very comfortable gurney. They're big. They've got windows. People worry about, I'm going to be claustrophobic in there, and it's even people that say they're claustrophobic, they get in there and they're like, that's not as bad as I thought. You've got windows. You've got more space than you think. I'm a big guy and I can stretch out in the chamber. With my arms, and once you get in, you'll almost immediately feel your ears pressurized. You want to clear your ears. It's literally like flying in a plane or driving through the mountains. As you pressurize up, there's zero pain. As the pressure goes up, you're just gonna let your ears clear, and then at that point you're in there, and if you're smart and want to disconnect, you'll leave your phone outside and do a little reading, meditating, thinking, stuff like that, which is healing in its own nowadays when we're so chained to our phones and work and stuff like that, However, in a chamber like that, if someone, wants to take their phone in and watch Netflix, it's, we've tested the oxygen consistently, and it's perfectly fine to do so. So it's the equipment's second to none. Our equipment is really good and over-engineered. It's very, very good equipment, very accurate equipment.
What are some of the common misconceptions you face? I'll have it open for both of you guys. Just curious that you address and clear up a little bit of the confusion.
It's funny, like I say, when people say, "Hey, is this like Cairo?" And I'm like, no, not. It's not. It's different than that. It's having people understand that oxygen is medicine. It's a very powerful medicine. Speaking as a layman here, every movie you see, the guy gets shot and goes in. What's the first thing to do? Is stick an oxygen mask on his face, right? Mm-hmm. Oxygen is medicine, and this is a medical device. And the medical benefit from off-label indications. It's just, I'll sound a little uneducated here, but it's, hey, I can heal your, whatever. I can heal the burns that chemo left behind, but I can't help with your concussion. I can't help with that knee that's inflamed. Right. Every single indication or every single FDA-approved, option, while they're very limited, these are serious wounds that nothing else is going to fix. If they had a topical for this, they would sell it to you at $1,000 a tube, most likely. Why are these things that are so nasty, severe burns, right? I can hear severe burns, but I'm not going to help you feel better, right, with oxygen? Because it's the same exact science. It's the same exact machine.
I went through medical school back in the mid-'90s and then went through the Cox Family Medicine Residency Program, graduated in 2000. I never heard about hyperbarics. They didn't teach that in medical school. You're out. I was at Mercy for 22 years. I never heard about hyperbarics. So, it's just not something that is, pushed onto, the normal everyday physician doesn't know about it. Yeah, they've got, Cox and Mercy have some of the hyperbaric chambers for the FDA-approved uses. There's not that many. There's not that many patients that are going to be for those uses. So, there's a handful of physicians in each system that know all about it, but everybody else, they don't necessarily know anything about it.
Do you see this changing in the next 20 years or so?
Yes, and I think it's going to be changing due to normal person preference for, just going and say, I'll pay for it, to heck with insurance. I want the benefit, I'll pay for it. And as the everyday guy population starts using it more and more, then it's going to trickle back into the medical community because there's going to be more and more patients that, I went and tried that hyperbaric thing and I feel a whole lot better after that hyperbaric treatment. And so the physicians are going to get it by, diffusion from the general public.
All the anecdotal, evidence is out there. You just don't find a lot of bad press on this stuff.
Yeah.
And if you ask the people that come in with a walker, come in with, oxygen, and then after, a month or two, they're walking on their own, ask, well, how much was that worth? They'd probably say every penny that I spent on it.
What'd you spend, a couple $1,000? If I could have walked up and said, here's a magic pill, I'll take that walker away for $10,000. There's a good possibility they're hold my walker, let me get my wallet. It's not, like I say, it's not a problem keeping people going. It's having them, as crazy as it sounds, make the time.
Yeah.
That is the most frustrating part. I don't ever get frustrated with the clients, their life, they can live it how they want.
Yeah.
But it's like, you need to go. It's not a magic pill. You need to go, and you need to go consistently in the beginning. We need to carve out the next couple of weeks and get you in 4 or 5 days for 90-minute sessions. And then after that, let's see how you feel. And then it's, I'm so busy. And you're so sick and not getting any better.
Yeah, I'm a physical therapist, and I've been pushing exercise as a treatment for a lot of things for most of my career. And I relate to what you're saying. Like, it seems like investing time, investing money, and our healthcare system that goes along with your analogy is, as I heard it said a couple of times, is really a sick care system, not a healthcare system. And prevention, I think, is kind of where you're leaning a little bit as far as catching things earlier in onset of disease and treating it earlier. Is that kind of where you're going?
Yes,
with things, is trying to do more
I do.
prevention?
I think it's or even earlier than the Hail Mary we talked about. That's so disappointing to me that I meet these great people and their loved ones, and they're so scared and they're so sick, and now they're trying it, and it's after everything else, they finally they get it so at their wits' end that they'll turn to Google or YouTube or podcasts and say, what else is there, because this isn't working. Yeah. Well, what if we got ahead of that? What if we could get ahead of that with that just early on we start forgetting the little things, and we start noticing that. And we have found that dementia patients are very stubborn. At least the ones we've encountered, it's hard to say there's something wrong with me that my doctor is trying to fix, but maybe there's not any. Maybe I just need more oxygen. Maybe I just need to exercise those teeny tiny blood vessels, and that's what the pressure's doing, and help them start to pump more oxygen into my brain and clear out some of that inflammation that's causing me to feel and think the way I do right now. I think to answer your question, preventative is huge. That's kind of like my guy there that I talked about. He's preventative. He was into this stuff because he's a wellness junkie. The biohackers into it. Your Gary Breckas, your Rogans, your Dana Whites. This is all in their protocol. But they're also rich and they're doing they got all kinds of stuff in there, right? Mm-hmm. I'm talking about average Joe that's feeling, that old tennis elbow is just getting worse and worse. Man, I'm getting so old, and we moan and groan when we get up. Hey, what if in conjunction with a little bit of exercise, and if we do up your blood oxygen and you feel better, you may be more apt to exercise and move a little bit more, right? Why don't people exercise as they age? It's some of them can't. What if we caught it before it got there? Or what if we got them feeling good enough to take that 2-mile walk every day? Whereas before, they just didn't have that energy.
Dr. Lilly, there's probably physicians that maybe end up watching this. What would you say to those physicians that may be a little skeptical?
Don't be so skeptical. And there is, and I was one. I'm kind of that way because the old saying of the plural of anecdote is anecdotes, not data. Well, sometimes you got to have a lot of anecdotes to get that data. They're doing research over in Israel trying to get that the data. So it's something that you got to at least think about, and have an open mind to think, maybe the hyperbaric is going to work with this person. Yeah. I've tried a couple of things and it's not working. And it may be better than just saying, well, let's give it some more time. A lot of times giving it more time doesn't mean it's going to get better. So instead of saying, well, just give it some more time, I'll see you in 4 months, say, well, try this hyperbaric thing, and then I'll see you in 4 months.
Yeah. Is it fair to say, Dr. Lilly, that in conjunction with the protocols, set forth by the doctor, that most of that stuff is going to be accelerated or benefit at another layer, given the body's ability to absorb more oxygen, carry more oxygen, reduce inflammation, and heal.
Right.
So we're not out here trying to say, oh, don't do, I don't have the brains or the know-how to speak to that. I can tell you, though, that what the simple science says is when the body is stronger, when the body is taking in more oxygen, when the energy level rises, good things happen. So that medicine that may be giving benefit could potentially be accelerated. We found it with peptides. You look at peptides, and we get into controversy. I mean, peptides can't be denied right now. Look at the GLP-1s, and what there's your peptide proof. Insulin being the first one. Okay, there's your peptide proof. People have found that hyperbarics supercharges peptide protocols. right? So
Can you help explain that to somebody who's never heard of this?
well, so peptides or
Yeah.
peptide. The way that peptides was described to me is you have inside your body, and this doctor, you help me out here. But inside your body, you've got these chains of amino acids that basically signal your cells to perform certain functions. And this is the way I absorb it and go, okay, that makes sense to me. So these cells, are signaling, burn that sugar, do this, do that, right? And as we age, those signals decrease. Well, reintroducing that peptide into the body allows those cells to start to pick up those signals again. Well, you look at the GLP-1s, for instance, the weight loss drugs that have exploded, right? Well, it's signaling the body, hey, eat less, you're full. And by the way, let's burn off the sugar. And those have gone from the semaglutide to the tirzepatide to now retatrutide, where that keeps getting better. They keep adding layers to that. And I think AI has put us in a place to, and I don't want to sound like a peptide expert, but AI has put us in a place to where the human genome has been mapped out very, very quickly. We're starting to understand at a very, very micro level how things work in our genes and our DNA. And we're starting to isolate, hey, this peptide could create this effect safely and somewhat naturally by reintroducing that into the body. When you couple that with hyperbarics, you've got to remember everything. Hyperbarics at its core is you're flooding that body with oxygen. That oxygen is getting liquefied, pushed down into the plasma. Your little cells are just eating this stuff up. They're happy. They can fight now. They can fight Mr. Nasty Cell over here. They can beat up those angry beavers that have clogged up your lymph system with microplastics and all the other pesticides and all this other junk we've put into our body that's in our food now. Now that oxygen, your good cells have the energy to go in, a little bit of armor to go in and say, okay, let's go to work, right? That's really what's going on when that ATP is created and the cells have energy at that mitochondrial level, right? I know I sound like a physician right now, but I'm not. I'm trying.
Let's hear from the
But
physician
at the end of the
next.
day, Doc, expand on it, because that's what going on in me. The layman, the average Joe that would just go to his doctor once a year, get his blood work. Oh, your blood pressure's a little high, Mr. Holman. You need to lose a few pounds, right? I'm like, you got it, all right? I'll do that. And then next year it's the same thing, or that carotid artery that caused my father's stroke, right? That was going to cost me $1,100 to go in with my quality insurance, right? To go in and get checked. Just to get checked. Hey, I'm a little scared here. Dad died or lived a very low quality of life for a very long time due to a massive stroke. And then eventually we lost him in 2020. Well, hey, I don't get this thing checked. Well, I show up for my appointment and they say, okay, it's going to, I said, $1,100. I ended up going to life screening. You get it every year now for like $150. But it's one of those things where to an average Joe, I started understanding, okay, this is how the body works. I don't study this stuff. I'm in a completely different field. But when I started saying, okay, when your cells have energy, they've got the energy to fight and so forth. So doctor put the physician spin on that one.
Peptides are small proteins. The body uses lipids mainly for the cell wall is made up of lipids. Carbohydrates are like glucose is a little molecule. You stick a bunch of those together and you have a carbohydrate. That is for food that the body uses. The brain can only exist on glucose. It's got to have glucose. One of the advantages of hyperbaric therapy is you are getting a lot of the peptides into the cells where it's needed, because same as the oxygen. It is pushing you to, take a shot of the subcutaneous injection of the peptide and then go into the hyperbaric chamber, and it will make that peptide get to the targeted tissues, the tissues it's supposed to get to, a whole lot quicker than if you weren't in the chamber. So it's making the peptides much, much more effective. And again, peptides have fewer side effects. The downside is you got to inject them. So that's one of the benefits of using a hyperbaric chamber along with the peptides.
So you do peptide therapy in conjunction at your facility?
Very, very, very soon.
Okay.
Coming
Coming soon.
We will, yes, we will have a full suite of peptides. We have seen and guinea pigged a little bit ourselves with certain peptides and using it in conjunction with hyperbaric therapy, because the peptides, Dr. Lilly, have you do it's a sub-Q injection. You literally don't feel it. I'm not a fan of needles in any way. It's not like you gotta it's not like you get a 3-inch needle you've got to shoot into your muscle. You don't feel it. It's like an insulin needle, same thing. And it's certain peptides in relation to inflammation, sleep, the aesthetic community has really picked up on the your glow peptides, different things like that. Well, we have found that Lori was trying a certain peptide that my daughter was also trying. One is in the chamber, one is without, and it's for the skin and anti-inflammatory properties and things along those lines. And she found that I'll tell you how old my wife is, but she's much older than my daughter, that the benefits were she outran my 30-year-old daughter's benefit with the chamber. So we backed up and said, okay, now, daughter, you go into the chamber, cycle off the peptide, and go back in. And she just felt a marked difference and saw it in her skin. She says, "This is amazing." Like what doctor said, we're getting the peptide deeper into the tissues, deeper into the cell with the hyperbaric therapy, versus just taking it and letting it build up over time, because it does have that very short, cycle through the body. It's where you have to inject a lot of these every day. And she was not only able to use a lower pressure, but in the chamber, but use less peptide to get a lot more effect. So it was really good walking those two, healthy women at a 24-year age gap through that and seeing effects on both. And that was, so we were able to really see it firsthand as, hey, it works there. And I think going back to like the conventional medicine, the traditional medicine, my thought is that, hey, whatever you're taking, should your doctor say it's safe to go into a high oxygen environment with that condition and with that medication, hey, can we give that more power to do its job as well?
How soon will you potentially have this service available?
The peptides?
Mm-hmm.
We're finishing up now. I should be ready to roll within 30 days.
Okay.
Wow.
What we want to do with peptides, because that's the Wild West too. I wasn't going to get into this today with you guys, but I'm happy to open the subject because it's coming and we're excited about it. But what's lacking out there is people go on and buy research peptides. What the customer that's not for us in relation to peptides is somebody who's okay going to a random website, getting a random vial of powder, and shooting that into their body. The peptide protocol will start with Dr. Lilly's consultation. It will start with blood work. And we will check that blood work quarterly. Again, we're results-based.
How can listeners find you?
So new home here. Actually, just within a couple of weeks, our signs just went up. We're at 5997 North 21st Street, right here in Ozark. And most of the locals will know it from being directly across from James River. But we're in the big Italian-looking granite building. So the Hyperbaric office is in there, and we're open 5 days a week. We're on 10 to 7. Again, my wife Lori and Keegan, both lovely people. It's to be big, big medical devices. We've wanted to make it as comfortable and as beautiful as possible. So you find it a lot like a spa type of environment where you can just, sit and relax and come visit with us, and we'll sit down and talk about what you're looking for. Trials are $20. We wanted to get you in there for a half an hour and just see, first off, can you clear your ears? If not, that's, it's a problem. We've got a couple of ways to not do that. And then, sit down and find out what those goals are, what you're looking for, and start there. And it's been an absolute pleasure. It was a pleasure being in Springfield, but we're pivoting now to we want to be a little more visible than we were before. We live in Branson, so I like that my wife's a little closer to home, and we just felt really at home there in Mr. Hush's building. We were looking at going to Medical Mile. We thought, hey, let's get down here in the heart of it, and there's so much traffic. And what we found with our people is we're more of a, our clients, is we're so much of a destination right now. It's not that important that we, have that street front exposure as much as having them be comfortable. And we were looking on national and got in pretty serious talks with a really nice place there, with the leasing company, and Lori, my wife, says, listen, I don't feel good. The traffic is heavy. These people are under a lot of stress. There's a lot of traffic. There's a lot of parking. There's a lot of businesses around. She says, Jay, I just want them to come in and feel relaxed. They need that. And I moved with her. I was like, we don't want to be down here. We want to get right in the heart of this thing. And it was so good to see her heart being just so lean towards having her customers, who a lot of them are under tremendous stress, say, no, I just want them to be relaxed. I want it to be an easy drive for them. I don't want them to fight traffic. I don't want them to fight parking. I don't want them to have to take the walker and go up 2 stories. It just made sense to me that, and that's what we've tried to bring to you guys. So we're $59.97 or 417 HBOT is the website there. So Hyperbaric Chambers of the Ozarks is, if you Google hyperbarics, we'll pop right up.
Well, for those of you who are watching and are looking for alternative approaches to dealing with a multitude of issues beyond what's FDA approved, there's a lot here in the Springfield, Ozark, Branson area, and the big thing we want to make sure people understand is that there's help out there for a lot of different things. This year we're going down looking at all aspects of wellness and improving your life, improving your health. But the overwhelming theme is that you really do have to kind of take charge of your own health, taking accountability for your own health. You can't 100% always just rely on traditional medicine for everything. Sometimes you do have to do your own research. You do have to look into other ways and ask a lot of questions. You do need to lean on your primary physician, but bring up these conversations, talk to them, ask them about things that you learn on this podcast. Because it's important to bring those antidotes to the surface, because that does lead to change in the healthcare system. We unfortunately do see a lot of issues where the healthcare system is hampered by greed. There's just no better way of putting it. And so the motivation, unfortunately, and what drives a lot of the healthcare research is based on what's going to make money. And so we do have to bring some other alternatives to the surface to make sure it's getting the same amount of press, so that people have alternatives to look to. And for those of you out there who, you may not need it right now or need it for yourself, you may know somebody, please send this podcast to them and subscribe, and all the fun things to help get this algorithm going a little bit more and maybe help somebody else in the process. All right.
Gentlemen, thank you again.
Thank you guys.
If you enjoyed today's conversation, make sure to like and subscribe so you never miss an episode.
And we'd love to stay connected. Follow us on YouTube, Facebook, and on Instagram at In Good Company Elder Care Podcast.
You can also find us on X, formerly known as Twitter, at IGC Pod, and on TikTok at IGC Elder Care Podcast.
Thanks for tuning in to In Good Company. I'm John Ray, and I've been joined by my amazing co-host, Spencer Ernst. Special thanks to our executive producer, Alex Wallace, for helping bring this show to life. Until next time, take care, and remember, you are always in good company.